Hello everyone, I wanted to hop on here and to talk to you about diastasis recti. This is the separation of the rectus abdominis muscles from the centre line of the body, and it can occur really naturally throughout pregnancy. And there are ways that we can help to correct this in the postnatal period, which I'm going to show you in a moment. It's really natural that women go through this, and it's something that actually is quite individual to every person. Before you become pregnant, you will have an element of separation through your connective tissue, the linea alba connective tissue between the two sets of muscles here. And it's important to know that, having a direct connection between the two muscles won't happen, because there is a connective tissue between them that pulls them together to keep that core strong. You may notice as well that, through checking it, you feel that you can't feel a separation, but perhaps you have some back pain, and you can feel that difficulty when you're doing certain exercises. And it might mean that actually you do have diastasis recti, you just haven't felt it yet through this normal way here. So how do we work out if we have it or not? Come onto the floor, come through your side and lay on your back. Bend your knees and keep your feet flat on the floor. Make sure that you have your stomach available and you can feel your belly with your hands. You're going to, first of all, just locate your transverse abdominis muscles. So place your fingers by your hips, and I want you to tilt the pelvis towards you. So you're pushing the belly button towards the floor, and I want you to squeeze into the floor, and you'll feel a pair of muscles, well, not pair, a set of muscles that will start to fire up and they'll harden. Okay, so this is you sort of activating your transverse abdominis, which is your almost corset that wraps through across your belly that helps you keep a strong trunk. First of all, I want you to lift up your shoulders from the floor, lifting the head and squeezing these muscles. You can place a fist behind your head if you need the support. Lifting up like this allows us to feel properly where there is a breakage in the core. So let's take 2 fingers width, and you're going to place them at the top of your abdominals, and you're going to slowly rock them from side to side, feeling any breakages, any gaps or any soft spots. Go all the way down. Lovely, and come all the way back up. For me, I have a slight breakage in underneath my belly button. It's just slightly softer and wider than the rest. Good, and come down. So there are loads of ways we can work on correcting our diastasis recti. And the first and most foundational is the pelvic tilt. And this is really integral to do for a lot of exercises postnatally. So to begin with, stay in your position with your feet flat on the floor and the knees bent. You're going to tilt the pelvis towards you, so you're sort of tucking the tailbone under, and you're thinking about pushing the belly button down to the floor, stitching it to the floor, and think about wrapping the belly up as if you're wearing a corset. So you're squeezing it nice and tight, and you're pushing your lower spine into the floor for me, and then release. And then rock, pull the pelvis towards you again, wrapping the belly up in the corset, and release. And again, squeeze. Make sure you're always breathing, you don't want to pass out. And release. Okay, that's pelvic tilts. Pelvic tilts can be followed by a march. So again, pelvic tilt to begin with. Next, you're going to lift one foot off the floor to 90-degree angle, and then place it back down and change sides. If at all your back pulls off the floor, you know that you need to reset and go back to the stage beforehand. Lift. Nice. Lift. The next exercise is a heel slide. So relax. Going to pelvic tilt again. Push the belly button to the floor. Wrap the core up with the torso. And then you're going to heel slide forward so that the leg is nice and straight, and then pull it back in, all the while keeping the back pressed into the floor for me. Squeeze. Drop the ribs, try to keep them low, trying to remove the space between the ribs and the pelvis. Okay, next exercise. Pelvic tilt, push into the floor, lift one knee, lift the other knee. We're in a half a tabletop position. So keeping the back nice and flat on the floor, transverse abdominis is wrapping the corset up. You're going to slowly tap one toe to the floor, come back, and again to the floor, come back. At this moment, you may notice that your belly pops and that you can't control the back coming off the floor. That means you should go down to the step below, which was the heel drags. Keep it nice and tight. Nice. And relax. That's it for now. Have a go with those, and then I will post some more soon. Thank you. Bye.